Unfortunately, Mr. Speaker, we heard such incredibly cold and bureaucratic remarks from the members of government. Quibbling with words, Mr. Speaker. The member from Calgary-Klein brought forward a motion that reflected the reality of what Albertans are seeing. They are seeing deaths, Mr. Speaker. And it's unfortunate, Mr. Speaker, that we have a government that cannot actually speak in real terms to Albertans about what they're seeing on the ground. They fall back on this bureaucratic word salad, on promises of beds that might materialize years down the road. Excuses, Mr. Speaker, but not one word of actual sympathy, of recognition, of humility to Albertans who frankly deserve an apology for what they've had to endure after 7 years of this government and the sad state of our healthcare system under their care. Let's be clear, our system is underfunded. The Minister for Hospitals said, well, hey, we're funding better than the NDP did when they were in government. Mr. Speaker, every year our government provided for population growth and inflation. Every year. This government has not. They have failed. Now, they will brag, Mr. Speaker, and they will talk about record funding, because, Mr. Speaker, if you add $1 to that budget, that is a record, because it is higher than it's ever been before. But the fact is, Mr. Speaker, they are underfunding the system for the level of population growth, for the level of demand, for the number of seniors, for the increase in folks that have complex health challenges. This government is refusing to provide the funding that's needed. Hospitals, Mr. Speaker, are absolutely over capacity. It's unfortunate that this government, again, is allergic to words that simply tell the truth. They just want to say, oh, there's a bit of pressure, Mr. Speaker. Albertans sitting in the ER at the Royal Alec don't just go, oh, gee, there seems to be a bit of pressure, Mr. Speaker. They see the reality. Folks are very clear, Mr. Speaker. This system is broken, and it's broken because this government has underfunded it, has refused to support it properly, and then on top of that, created 4 times the bureaucracy. The minister talked about how proud he is of the steps they're taking towards, transparency and accountability, sharing data with Albertans. Mr. Speaker, I can tell you, Albertans have never had less information about what's happening in their healthcare system. Actual data and statistics, never had less, because this government gutted it. They took it offline, they hid it behind closed doors, they buried it. And the information Albertans do get, Mr. Speaker, it's never been more heavily torqued and twisted, cherry-picked. This is not a government, Mr. Speaker, that plays honestly with Albertans about the state of their healthcare system. They tore apart the accountability that existed, and now they want folks to pat them on the back for restoring a little bit more. Though I guess I have to admit, Mr. Speaker, that they are at least a little bit honest, because they do honestly show that wait times have grown under their government for surgeries, despite the fact that they claim they are spending record amounts on surgeries, Mr. Speaker, and they brag about all the private facilities they're funding. Publicly delivered surgeries are dropping. Wait lists are growing. Those are the realities, Mr. Speaker, but they don't want to have reality in this motion. They don't want to acknowledge reality with Albertans. The fact is, Mr. Speaker, we have tried. The member from Fort McMurray Wood Buffalo talked about, well, we want to be collaborative, Mr. Speaker. If they wanted to be collaborative and truly live up, then they would have passed Bill 201 back in December 2022 when it was brought forward by our then Leader of the Opposition, Rachel Notley. That was a piece of legislation that would have actually delivered on providing transparency and data for Albertans. Bill 201, the Public Healthcare Delivery Act, would have required mandatory public tracking. It would have required a mandatory action plan. If the public targets for those standards were missed, the government would be required to develop a formal, actionable plan to address the shortcomings. Not announcements, Mr. Speaker, about beds that they might build 4 or 5 years down the road. That's not going to do anything, Mr. Speaker, to deal with the real overcapacity, or in the government's parlance, pressure. Bill 201 would have empowered the Health Quality Council of Alberta to set those standards through actual consultations with healthcare workers, patients, and communities. Now, of course, Mr. Speaker, the chair that was appointed of the Health Quality Council of Alberta, Dr. Ross Sherman, he quit. He tried to work collaboratively with this government after running for a seat with this government, and he quit and he walked away, and he is now one of their most vocal critics in terms of the mess they have made of the healthcare system and indeed of the death that we saw in the ER in December. He has been vocally critical of the Minister of Hospitals for his lack of action, lack of follow-through, the few concrete actions they promised, Mr. Speaker. The minister still has not delivered. It was a simple one. Just have ER doctors posted to help with triage. They promised that within a couple months, Mr. Speaker. Here we are, month of May, not one of those doctors is in an ER. We have hollow promises. We have empty words. Albertans have soaring wait times. They have family members that are suffering. They have fear and anxiety about whether the services and the support they need is going to be there when they need it. And this government's concern, Mr. Speaker, on that isn't saying, yeah, you're right, we need to do better, let's see how we can do that. It's to quibble with words and emotion so they can feel better. Mr. Speaker, I don't need this government to feel better. I need them to feel significantly worse, because then maybe we would see some actual, concrete action to improve the healthcare system for Albertans, to address the crisis. But this is a government, Mr. Speaker, that doesn't believe in that. You know, perhaps if every Albertan in an ER room was an Alberta separatist, Mr. Speaker, they might get the Premier's attention. Perhaps if they could couch it in a conspiracy theory about voting machines or vaccines, then this government would consider that something worthy of taking action on quickly. Maybe if it was a library book that they didn't like, then we would actually see some action taken. But no, Mr. Speaker, what we see is that when it comes to the real things Albertans need, real action to improve the healthcare system, to address these soaring wait times in our ERs, to ensure Albertans have actual access to primary care, this government drags its feet. They slow walk, they hold pressers, they make empty announcements. Mr. Speaker, I want to thank the member for Calgary-Klein for trying to put forward some truth.